Imagine this. A horse, perfectly healthy, vibrant even, enjoying its feed. And then, almost out of nowhere, something goes terribly wrong. Within just hours, maybe a few days, you start seeing these really alarming neurological signs. Stumbling, maybe circling, pressing its head against the stall wall.
Yeah, it's terrifyingly fast sometimes.
Exactly. Or they can become agitated, unpredictable, and it often ends badly, either death or permanent brain damage. And the worst part, often no clear cause until it's way too late.
It's a real tragedy when it happens. Silent but devastating.
So today we're going to pull back the curtain on this. We're doing a deep dive into equine leukoencephalomalacia elam, or, as it's more grimly known, moldy corn poisoning.
A very fitting, if grim, name.
Our mission here is to really unpack the science. What causes it? How does it actually harm these amazing animals? How do vets even try to diagnose it? And crucially, what can you do to prevent this? We're going to pull out the key insights from the research, turn the complex stuff into something clear and actionable.
It's incredible, really, how something microscopic, a fungus, can unleash such catastrophe on an animal like a horse.
You've set the stage perfectly. Catastrophe. So let's dig in. What is the thing driving elam? What are we actually dealing with here?
Okay, so at the very heart of elam, you've got these dangerous compounds called fumonisins. They're a type of mycotoxin, basically, mold poison.
Mycotoxins, okay.
Yeah, and they're produced by a specific mold, a fungus called Fusarium verticilioides. Used to be called Fusarium maniliform. And when we're talking about horses, the main player, the most toxic and common one, is fumonisin B1. We just call it FB1.
FB1. So these fumonisins, these mycotoxins, they're the direct cause. And what does elam, the disease itself, actually do inside the horse?
Exactly. They are the direct culprits. Elam itself is this rapidly progressing, often fatal neurological disease. It hits horses, ponies, donkeys, mules, the whole equine family.
And the damage?
The damage isn't subtle. If you were to look at the brain after death, you see these really characteristic lesions. It's a literal softening. And death, the technical term is necrosis of the white matter.
Necrosis.
Yeah, in the cerebral hemispheres, the main part of the brain. It's like, well, parts of the brain tissue essentially liquefy, turn to mush, and sometimes you'll also find the liver looks abnormal, swollen, discolored.
That image, brain tissue turning to mush. It's horrifying. But how? How do these tiny toxins cause such massive specific damage? What are they actually doing at a cellular level?
Right. This is where it gets scientifically really interesting. Fumonisins act like molecular imposters.
Imposters?
Yeah, their structure is incredibly similar to these vital components in every cell membrane called sphingolipids. Think of sphingolipids as crucial building blocks and also communication molecules for cells. Specifically, fumonisins mimic things called sphingosine and sphingonine.
Okay, so they look like these important cell parts.
Exactly.
Yeah.
And because they look so similar, they can interfere. The core mechanism, the real aha moment here, is that fumonisins block a key enzyme called ceramide synthase.
Ceramide synthase, okay.
This enzyme is critical in the whole process of building and recycling these sphingolipids. So, blocking it, it's like throwing a wrench into a vital assembly line in the cell.
A cellular blockade.
Yeah.
And that causes a backup, right? A buildup of those things they mimic, the sphingosine and sphingonine.
Precisely. When ceramide synthase is blocked, you get this toxic accumulation of sphingonine and sphingosine inside the cells. This buildup completely disrupts normal cell function, messes with the membranes, cell signaling goes haywire, and eventually it leads to cell death.
And that cellular chaos leads to the symptoms we see.
That's the thinking, yes. The clinical signs, the brain lesions. It's thought to stem from these sphingolipid changes, messing with the blood vessels in the brain, leads to vascular dysfunction, swelling or edema, and even breakdown of the blood-brain barrier.
Wow, so it lets things into the brain that shouldn't be there.
Right. But it's not just the brain. The same mechanism can affect other systems. You can see cardiovascular dysfunction, heart problems, and hepatocellular necrosis, liver cell death. There's even some lab work, in vitro stuff, suggesting it might impact hoof health, the laminae specifically.
It seems to hit multiple systems then, even if the brain is the main target in horses. Now, you mentioned something interesting earlier, that these toxins aren't actually absorbed very well in most animals.
That's generally true, yes. In most species, after they eat fumonisins, the absorption is pretty poor and they're eliminated quickly. So finding them in tissues is often difficult.
There's always a but.
There is for horses. Fumonisin B1 does cross the blood-brain barrier in horses. That's the critical difference. Even if it's cleared fast elsewhere, it gets into that protected space and does its damage.
Which explains why the nervous system is the primary target organ in horses.
Exactly. Followed by the liver, the hepatobiliary system, as the secondary target.
Okay, this leads us straight into risk factors, because understanding where and when this happens is key to prevention. You said moldy corn. Is it always corn?
Almost exclusively, yes. Exposure is overwhelmingly linked to eating moldy corn or corn-based products. That means whole corn, cracked corn, pellets made with corn, corn screenings.
Screenings, like the leftover bits.
Yeah, the broken pieces, dust, often considered lower quality. We have seen, very rarely, reports of fumonisins in things like black oats from Brazil or some hays and grasses in specific areas. But honestly, 99% of the time, it's corn.
And what kind of conditions make the corn moldy with this specific fungus?
It's kind of a perfect storm scenario, environmentally. You often see it after a period of drought while the corn is growing, followed by cool, wet weather during pollination and when the kernels are developing.
Drought, then wet. Interesting.
Yeah, and then after harvest, high moisture and warm temperatures during storage. That dramatically increases the risk, too. Oh, and insect damage to the ears of corn out in the field also makes it easier for the fungus to get in.
So a lot of factors have to line up. Does that mean it's only a problem in certain regions or seasons?
Outbreaks do happen sporadically, all over the world, really. But they are typically seasonal, often peaking from late fall through to early spring. But here's the kicker. Contaminated corn gets shipped globally. So a problem that starts in one region's field can end up in a feed bag anywhere.
That's a crucial point. And you mentioned screenings. Are they riskier?
Definitely. The highest concentrations of fumonisins are almost always found in the broken kernels and screenings, which is worrying because sometimes those are specifically included in cheaper feed mixes.
Okay, so dose makes the poison, as they say. How much does it take? We know horses are super sensitive.
They are the most sensitive species we know of to fumonisins. It's actually quite shocking how little it can take. Clinical signs of elam, the neurological form, can show up after eating feed with as little as 8 to 10 parts per million ppm total fumonisins for about 30 days.
8 to 10 ppm, that sounds tiny.
It is. But if the concentration is higher, say they eat feed with more toxin over just 7 to 10 days, that tends to cause the primarily neurological form, the elam. Lower doses, eaten over a longer time, might lead more towards liver damage, hepatotoxicosis.
So the pattern of exposure matters too.
Absolutely.
Yeah.
And here's something really, really important for anyone handling feed. These fumonisin toxins are incredibly stable. They're water-soluble, but their heat-stable cooking doesn't destroy them. They're resistant to alkali treatment, sometimes used in feed processing. Basically, once they're in that corn, getting rid of them is extremely difficult, almost impossible practically.
Wow. Okay. That really underscores why prevention is so vital. There's no cleaning it up afterwards.
None whatsoever. Prevention isn't just the best strategy, it's really the only strategy.
So let's say prevention failed or someone didn't know. The horse has eaten the contaminated feed.
Oh.
What are the signs an owner needs to be watching for, and how fast does it happen?
Typically, the signs pop up pretty suddenly, usually after several weeks, maybe 3-4 weeks or more, of eating the contaminated feed daily. And once the signs start, they tend to get worse very quickly. It's characterized by that acute onset and rapid progression.
And the neurological signs you mentioned. That sounds like a nightmare. Can you walk us through what an owner might actually observe?
Sure. The neurological form is the most common. You might see really striking changes in their mental state: apathy, dullness, depression, drowsiness. Sometimes they seem almost asleep on their feet, like a stupor.
Just not right.
Exactly. Then you get compulsive behaviors. Aimless wandering, just walking and walking, circling, sometimes just in one direction. Head pressing is a big one, literally pushing their head against a wall or fence, or just leaning heavily on things.
And problems with movement.
Yes, very common. Ataxia that's incoordination, staggering, weakness, especially in the hind end, sometimes hypermetria, where they lift their feet really high and exaggerated when they walk.
Any sensory issues?
Blindness is sadly quite common, often in both eyes, because the damage is in the brain's visual cortex. Their pupils might be dilated, fixed, not reacting to light. And other serious things can happen too, like dysphagia, difficulty eating or swallowing.
That must be distressing to see.
It is. And sometimes, paradoxically, they can flip from being depressed to being hyperexcitable or agitated. A horse that was quiet might suddenly become frantic if disturbed, leading to tremors, muscle twitching, sweating. In the worst cases, you get seizures, convulsions, then they go down, become recumbent, fall into a coma, and death.
And tragically, as you said, sometimes they're just found dead, no observed signs beforehand. And interestingly, their temperature usually stays normal through all this.
Generally, yes. Fever isn't a typical sign of ELM itself. Now, while the brain stuff is most common, sometimes you see the liver involvement taking center stage or happening alongside the neuroscience.
What does that look like?
With liver failure, you might see loss of appetite, anorexia, icterus, which is jaundice, yellowing of the gums and eyes. You might see little pinpoint hemorrhages, petechiae, or larger bruises, ecchymoses, on the gums because their blood isn't clotting properly. And swelling, edema, especially under the belly, on the head, or down in the legs.
So it could be brain signs, liver signs, or a mix.
Right. And which picture dominates seems to depend on, the actual fumonisin concentration in the feed, how long they ate it, and probably some individual horse susceptibility factors we don't fully understand.
Okay, so faced with these kinds of signs, how does a vet figure out if it's actually ELM? What's the diagnostic process?
It really starts with the history. That's absolutely critical. Has the horse been eating corn or corn-based feed recently? Especially if the owner knows it was moldy or maybe stored improperly. That's a huge red flag.
And the pattern of illness.
Yes, the acute onset of neurological signs, the rapid deterioration, and especially if multiple horses in the same group are showing similar signs, that makes ELM very high on the suspicion list.
So history is key. What about lab tests to confirm exposure? Can you test the feed?
Yes, testing the suspect feed is the gold standard for confirming exposure. You send samples to a lab for fumonisin quantification. They'll look for FB1, FB2, FB3. But interestingly, getting a truly representative sample can be tricky.
Why is that?
Because of hotspots.
Yeah.
The fumonisins aren't usually spread evenly through a batch of feed. You might grab a sample from one part of the bin that's low, while another part is dangerously high. Plus, there's that delay, that latent period between eating the toxin and getting sick, which can make it hard to pinpoint which feed batch was the culprit.
Right. And you said just looking for mold isn't enough.
Absolutely not. That's a critical point. You cannot rely on visual inspection. Corn can look perfectly fine and still be loaded with fumonisins, or it can look moldy with harmless molds. You have to test.
Okay, so testing the feed confirms exposure. What about testing the horse itself while it's still alive? Is there a specific blood test?
There is, and it's actually a very sensitive and specific biomarker. It's the ratio of sphingonine to sphingosine in the blood serum, the SASO ratio.
Ah, those compounds that build up because the enzyme is blocked.
Exactly. Because fumonisin directly causes their accumulation, measuring that ratio is a highly specific indicator of exposure, and usually toxicosis. In affected horses, the ratio is often elevated, say above 0.4, and frequently way up over 1.0.
And that can show up early.
That's what's so valuable about it. The SASO ratio can be elevated before the horse even shows clinical signs, or before you see changes in liver enzymes on a standard blood panel. It's like an early warning signal of exposure.
That's incredibly useful for vets. Are there other lab tests they might run?
Sure. Standard serum biochemistry might show elevated liver enzymes, AST, GGT, ALP, bilirubin, if there's significant liver damage happening. But a complete blood count, a CBC, is usually pretty nonspecific, doesn't tell you much. Analyzing cerebrospinal fluid, CSF, might show some changes, but again, often not specific to ELM.
So the SASO ratio and feed testing are the big ones for figuring it out while the horse is alive. What about confirming it definitively, especially if the horse unfortunately dies?
Post-mortem examination, a necropsy, provides the definitive diagnosis.
Yeah.
Grossly, meaning what you see with the naked eye. The classic finding is those areas of softening, malacia, or even cavitation holes in the white matter of the cerebral hemispheres. Often it's asymmetric, worse on one side than the other, and the liver might look abnormal too.
And under the microscope?
Histopathology confirms it. Looking at the tissue samples microscopically shows the characteristic liquefactive necrosis, the dead, mushy brain tissue in the white matter. That seals the diagnosis.
It all sounds so devastating. Which brings us to the really hard question. Can anything be done? Is there a treatment?
Yeah.
An antidote?
This is the toughest part of the conversation, honestly. The blunt answer is no. There is no specific antidote for fumonisin poisoning.
Not at all.
None. By the time a horse is showing those neurological signs, significant brain damage, often irreversible damage, has usually already occurred. The changes happen quickly, and they are profound.
So the outlook is not good.
It's incredibly dire, which makes the next step absolutely critical. If you even suspect ELM, what's the very first thing you must do?
Get rid of the feed.
Immediately. Remove all suspect corn and corn-based feed from the affected horse, and just as importantly, from every other horse or susceptible animal in the herd that might have had access. Stop the exposure instantly. That is paramount.
Okay, stop the poison. What then? Is there any supportive care that helps?
Treatment becomes purely supportive and symptomatic, trying to manage the signs and support the horse's system. This can include IV fluids for hydration. If the exposure was known to be very recent, like within hours, maybe activated charcoal or mineral oil via stomach tube to try and limit further toxin absorption, but that window is small.
What about the agitation?
Sedation is often crucial. For horses that are agitated, hyperexcitable, or frantic, sedatives are needed for their own safety and for the safety of the people handling them. Anti-inflammatories like NSAIDs might be given to try and reduce brain inflammation, but honestly their effectiveness is pretty limited given the nature of the damage. And basic nursing care, keeping them comfortable, safe, providing nutritional support if they can't eat, is vital.
But even with all that supportive care, the prognosis for the neurological form remains.
Extremely poor, often described simply as grave. Most horses that develop the neurological signs of ILM either die on their own or are euthanized because the brain damage is just too severe and irreversible. They might become permanently recumbent, unable to stand, or have such severe behavioral changes that they're dangerous or have no quality of life.
How quickly does that usually happen?
Typically within 24 to 72 hours after the neurological signs first appear. It's incredibly rapid.
Are there any survivors?
It's rare. Very rare. The few horses that do survive the acute neurological crisis often have significant permanent brain damage, permanent neurological deficits. They might be uncoordinated, show abnormal behaviors. They unfortunately sometimes get called dummy horses because of the lasting cognitive impairment.
That's heartbreaking. So it really hammers home the point. With no real cure and such a terrible outcome, prevention is everything.
It is the only truly effective strategy against ELM. Full stop.
Okay, so let's talk prevention specifics. Rule number 1 seems obvious, but needs saying.
Absolutely. Never, ever feed moldy or suspect-looking corn screenings, or any feed-containing corn products to horses. Just don't do it. And remember, crucially, you can't just trust your eyes. Visual inspection for mold is not a reliable way to tell if it's safe.
So source matters. Where should people get their feeds?
Purchase corn and corn-based. Feeds only from reputable suppliers. Ideally, suppliers who routinely test their products for mycotoxins, including fumonisins. And don't hesitate to ask for a certificate of analysis that shows the fumonisin levels for the batch you're buying. You have a right to that information.
Be proactive about testing, too.
Yes. If you are feeding significant amounts of corn or corn products, maybe it's a key part of your feeding program, especially during those high-risk times of year. Or if you know the weather conditions were conducive, seriously consider submitting samples of your feed for fumonisin analysis yourself. Test it before you feed it, or routinely.
Makes sense. What about storage? That came up earlier.
Proper storage is absolutely key. Store all corn and feed in a dry, cool, well-ventilated place. Protect it from moisture rain, humidity, condensation. Keep it protected from insects and rodents, as they can damage kernels and introduce moisture or mold spores. And generally, avoid long-term storage of feed. Use it up reasonably quickly. Buy smaller amounts more often if possible. Fresher is generally safer.
Are there official guidelines on safe levels?
Yes. The U.S. FDA has advisory guidelines. They recommend that total fumonisins, FP1 plus FP2 plus FP3, in corn, and corn byproducts meant for horses should be no more than 5 parts per million ppm.
5 ppm max.
Right. And importantly, those corn products should make up no more than 20% of the horse's total diet on a dry weight basis. So limit the amount even if it tests below 5 ppm. And the FDA explicitly advises that corn screenings should not be fed to horses at all because the risk of high toxin concentration is just too great.
That's a clear recommendation. Avoid screenings entirely. What about diversifying the diet?
That's another smart strategy. Try not to rely too heavily on corn as the main energy source in the diet. Mix it up, incorporate other grains like oats or barley, and of course, plenty of good quality forage. Spreading the ingredient sources helps dilute the risk from any single one.
Okay, one last thing that people often ask about. Mycotoxin binders. Do they work for fumonisins?
That's a really common question. There are products out there, often clay-based, like bentonites or yeast-derived products, that are marketed to bind mycotoxins in the digestive tract and prevent absorption.
Sounds good in theory.
It does. However, the research on their effectiveness specifically against fumonisins in horses is, well, it's variable and often suggests incomplete binding. They might bind some other mycotoxins better, But for fumonisins, they're definitely not a magic bullet. They should absolutely not be relied upon as your sole prevention strategy, especially if you know you're in a high-risk situation or feeding suspect ingredients. Think of them as maybe a minor supplemental tool at best, but not the main defense.
So rely on sourcing, testing, storage, and diet diversification first and foremost.
Exactly. Those are the cornerstones of prevention.
Right. Well, we have covered a lot of ground here. We've taken a really deep dive into equine leukoencephalomalacia, ELEM. We understand now it's this swift, often fatal neurological disease. It's caused by these fumonisin mycotoxins lurking mainly in contaminated corn. We've seen how these toxins have this unique way of messing up cell function, blocking that key enzyme, leading to that devastating brain damage. And we've confronted the harsh reality that early detection is tough and effective treatment is, sadly, pretty much non-existent.
And remember that core mechanism, the inhibition of ceramide synthase, leading to the buildup of sphingidine and sphingosine, that's not just academic. It explains why that seso-blood ratio is such a specific marker for exposure. It connects the how to the how we detect it.
Absolutely. So wrapping this up, what does this all mean for you, the listener? Well, beyond the immediate concern for horses, this deep dive really shines a light on these hidden dangers that can be present in feed supplies for livestock and potentially, down the line, even impacting human health through contaminated food products.
It's a stark reminder, isn't it? How connected everything is, the environment, those tiny fungi, the complex biochemistry inside an animal, and ultimately its health and survival.
It really is. Which leaves us with a thought to ponder. What other unseen threats might be out there, waiting in the environment and the food chains we rely on every day that we haven't discovered yet or don't fully understand? It certainly makes you think, doesn't it?